think a lot of times women with substance use disorders are not afforded the same access to healthcare as the general population, and that really doesn't need to be the case. It's really important to offer these services to patients with substance use disorders, both men and women, so they can both be educated. And it's been seen as a gap in treatment. So most of the times women will say, that's okay, I'm just gonna use condoms all the time. And for some women, they may be in relationships where they don't have that power to have negotiation. And so that might not be feasible. I think working with women with substance use disorders, they feel like a lot of things in their circumstance are so out of their control that offering them solutions for things, for preventive health measures that put them in control is very, very powerful.
There is a need among women with substance use disorders for non-coercive family planning services. Women with substance use disorders are entitled to the same reproductive rights and services as women without a substance use disorder. In the general population, 45% of all pregnancies are unintended, meaning that the pregnancy was mistimed or unwanted. In women with substance use disorders, 86% of pregnancies are unintended. Reducing the rates of unintended pregnancies is a public health goal associated with improved maternal and child health outcomes. Women with substance use disorders also give birth to greater numbers of children over their lifetimes and have higher rates of abortion. Unintended pregnancy is closely tied to contraceptive choice and use. Consistent use of effective contraception is what prevents an unintended pregnancy. The World Health Organization groups contraceptive methods into 3 tiers based on effectiveness of how many unintended pregnancies occur on the method annually per 100 women. Tier 1 consists of very effective methods, including reversible methods such as the implant or intrauterine device, and permanent methods such as a tubal ligation or vasectomy. Tier 2 consists of effective methods and includes the hormonal shot, oral contraceptives, patch, and ring. Tier 3 consists of less effective methods and includes male and female condoms, withdrawal, spermicide, the sponge, and natural family planning. Women with substance use disorders are less likely to have access to preventative health services, including family planning. For many women with substance use disorders, engagement in addiction treatment programs serves as their only entry into the healthcare system. Health professionals treating women with addiction issues have a responsibility to offer family planning services in line with each patient's individual reproductive plan. A provider can start by asking, "Would you like something to prevent pregnancy today?" If the answer is no, the patient should be linked to preconception or prenatal care. If the answer is yes, a provider should assess if the patient is currently using contraception and provide education and counseling on available options. A provider can help a patient make an unbiased and informed decision about the right birth control method. To make an informed choice, the patient's acceptance must be voluntary. Providers must make it clear that using contraception is not a prerequisite to receiving services. Healthcare workers need to provide comprehensive information and access to family planning services to ensure women make voluntary and informed choices. Offering family planning services within addiction treatment programs will help reduce unplanned pregnancies.